All right, we are here for our final panel, Public Policy Implications, and Terry Lakowski is going to be our moderator. I want to share with you, though, before we begin, we're going to change the afternoon schedule around just a little bit and get everyone out of here a little early this afternoon. Because we've had the opportunity to have kind of lengthy Q&As and we've heard from many of you, what we're going to do is we're going to do this final panel presentation, and then we're going to do about 15 minutes of closing reflections and comments from all of you. And then Dr. Satcher is going to get up and speak for about another 10 minutes or so, and then we'll be on our way out of here. So instead of ending at, say, 4:45, I think we'll get out of here maybe even probably about an hour early. So allow everyone to get back to their hotel or wherever they're going and get home a little early. So with that, I will introduce Terry Lakowski, who will be moderating our Public Policy Implications panel. Thanks.
Thank you very much. I'm so glad there was so much conversation in the last panel about policy, so we're done. We can just close up shop and get you guys out of here even earlier. But it's really good to see there's a lot of interest in that discussion and a lot of expertise in this room. So I want to encourage everyone, even throughout our panel, to chime in and contribute to the debate and discussion that we're going to be having, because we don't want to be the only ones talking, especially since we know there's a lot more people who probably know more than we do in this very room. And also, just kind of to get started, actually, I just wanted to see by a show of hands how many people's organization or school or institution is currently working on policy initiatives in some capacity, whether it's at the state level or locally. Great. Okay, well, this should be a really interesting discussion. Just to kind of set the stage, when we talk about policy, there's obviously a lot of different levels of policy that we can influence. You know, local school policy, policies of national governing bodies, policies of the professional leagues like the NFL. For the purposes of this panel, we're going to primarily be talking about government policy, both at the state, local, and federal level. But I also want to, at the end, have a little discussion and probably tap into some of the people in the audience about what you see that's happening on the policy side with some of these major players in the private sector at the NGB level and the league level as well. But wanted to kind of do a primer, and we've been asked to talk more about what we've seen happening, particularly at the federal level in the policy space relative to this issue. But first, to set the stage, I'm going to have Joe talk a little bit about what we've been seeing at the state level, because really they've been ahead of the curve for the federal government, which is no surprise. The federal government's usually a little slow to the table. And really done a lot of action thus far in addressing concussion at the state level. So, Joe?
Well, first of all, thank you guys for having me. Joe Briggs with the NFL Players Association. We've seen our business partner in the National Football League and the NFLPA has supported a number of different laws on the state level. On the state level, we've seen a version of the Zachary Lystat law come into play in a number of different jurisdictions. I believe we're up to 49 and the District of Columbia now, with Mississippi being the lone law that doesn't have a concussion law on the books.
Joe, I'm sorry, I'm going to interrupt you 1 second because not everyone is as smart as you. Could you explain what that law is?
So it's the Zachary Lystat law was a law that was created out of a situation that happened in Washington State. There was a young man who was playing football and was injured with a concussion and returned to play too soon by many people's perspective, and as a result of which the injuries were bad, to put it lightly. The outgrowth of that was his parents and the people around him in Washington State passed a law called the Zachary Lystat law to create better protocols around not only return to play, but when medical advice should be sought after an injury at a local game, at the local level. What we've seen is a version of that law passed in a number of different jurisdictions. And I think one of the things that Terry wanted me to talk about was how those laws have affected some of those local jurisdictions, right? It's great when we go in and we support laws, and the NFL Players Association has supported these laws being placed on the books. But we've been very careful with our support because we know that sometimes by creating requirements at the state level that a local jurisdiction can't afford, you may actually do more harm to sport than you do good. And what we've seen is a number of jurisdictions say back to us when we would go out and canvass the areas to see if they wanted us to come in and support this law as it was presented to their local jurisdictions, that they can't afford, in some instances, to have the medical staff on the sidelines or participating full-time in their programs. So we've been very careful in our support, making sure that we understand exactly how we can use other methods to get the same training and concussion protocols into the local jurisdiction without increasing financial hardships on these local jurisdictions as well. The biggest challenge that we have as the NFL Players Association is that we represent players in 32 different teams in a number of different states all across the country. Some of those states that have asked us to support them, we don't have players in those jurisdictions, but we do have fans in those jurisdictions. So we try to make sure that whatever policy changes we make on the national level through the National Football League and push through our Players Association, we also make sure that that filters down to the state and local level and the other various levels of the sport. I just saw a representative of the NCAA walk in the room. We try to do our best to work with our compadres at the NCAA and also at the high school and Pee Wee level or Little League football level to make sure they understand the protocols that we put in place and why we're doing it. There are a number of reasons that we've tried to make the game safer, not just around concussions, but also around accountability as well.
Thanks, Joe. Joy, I know you have a very extensive background in policy, and just curious from your perspective, with all the activity that we've seen thus far at the state level, is there still room for the federal government to step in and take action in this area?
I think that there is an opportunity to impact federal policy, but I think in terms of the politics that is the status today, that is difficult because at the House level, and I saw so many hands who are engaged in federal policy, so you probably already know, but at the House level there is a really strong reluctance to enact federal laws because of the concern about an overreaching central government. And so to the organizations who are really trying to make an impact here, you really have to reach out at the state level, and you have to message very, very carefully in any effort in engaging your federal officials. So, for example, when you visit congressional offices on the House side, and you visit the office of a Tea Party member, for example, and you want to promote, advocacy to try and, get a federal initiative started to make sports safer for young people and professionals, you really need to consider that member of Congress and the constituents who are influencing that member of Congress. And because of the way districts have been drawn, there are many very, very conservative members, especially on the House side, who just have a very difficult time answering to their constituents about broadening federal laws. So you have to message very carefully to those members. I think that there are opportunities, but it has to be done very delicately.
I think you make a good point in terms of making the case. I think a lot of us in the room were kind of preaching to the choir, and for us it's enough to say this is the right thing. We see the importance for it, for what it does for kids. We get it. But that's often not enough, especially on Capitol Hill, to just do it for the right reasons. There has to be a very clear ROI for the members in terms of how it's going to affect their constituents back home. So I'm going to toss this to anyone on the panel. Just how do we frame this message then in a way that's going to resonate with the policymakers here and the issues we know they're dealing with to make them join our cause? Because it can't just be enough to say, this is a health issue, this is important. What can we say? What should be our framing message?
Well, the one thing that I've seen on the federal level is a combination of attacking the problem from not only a sports perspective, but from other industries that also have similar health concerns. There was legislation dropped, I believe it was in the last Congress by Congressman Bill Pascrelli around contact, which was supposed to address not only the Department of Defense's concern about military personnel and their experiences with concussions, but also sport and youth sport experiences with concussions. That's been a very effective model at not only getting more members interested, but a bipartisan effort to get members on both sides of the aisle interested in an issue. We've seen some traction there, but I know there have been some other things that Congress has had to talk about and discuss in the last couple of years. So I don't know that that's gone anywhere. But I do know that I believe we saw Senator Udall this Congress just dropped a bill around youth concussion that I think, again, is trying to address the issue. Specifically, he's looking at helmets and some of the helmet technology around concussions, but I think that's another thing that he's using to get parents concerned. Parents are paying for the equipment that their children are using in these sports, and therefore he's trying to get people engaged in the purchasers engaged in making sure that the equipment that they're purchasing is as safe as possible.
That's a really good point, Joe, and just to expand upon that. So I think typically what we've seen thus far, particularly in this Congress, is the legislation tends to fall into kind of three different categories. You have the research side, which is what you're talking about, the bill with Representative Pascrell, which really also focuses on youth as well as the military and TBI. You have the kind of equipment, kind of product safety side, which Senator Udall has a bill that has a lot of problems with people on the sports manufacturing side, that it's just not really practical in its strategies. But that's kind of the other piece. And then the third bucket of policy deals with return to play protocol. And you have Senator Durbin, who's recently introduced a bill with that, as well as Representative Bishop and Miller, who will soon be introducing a similar bill. And Senator Menendez has another one, which does provide some funding in order to implement it. But they tend to fall into those three buckets of policy. Could you tell us a little bit about what's happening on the administration side relative to this issue?
Yes, and I was just thinking, having spent 6 years on the Hill and then 4 years in administration, I think there's a lot more opportunity to work with the administration to push forward policy, just given the political gridlock that we're seeing across so many different areas on both sides of the Hill. And I think for the administration, there's tremendous authority and fewer resources, unfortunately, but a lot of potential there that I think you're already starting to see has been extremely helpful in addressing the issue. I mean, first, if you look at the CDC and their Heads Up initiative, I mean, they're at the vanguard of looking at the state policies, trying to sort out which states are doing what and what the policy impact will be. They have toolkits and resources available for parents and schools that can be downloaded. They have published the statistics on which youth are being injured in different sports. And so I think that is a prime example of how the federal government, in the absence of new legislation, can still push forward with existing resources to address the challenge. But I would have to say, even stepping aside from the specific focus on concussions and youth sports safety, some of the other initiatives, which I know that has been touched on earlier today, will also be tremendously helpful. One example certainly would be the BRAIN initiative that this administration announced a little over a year ago at this point, really focusing on having a better understanding of the disease processes, the pathophysiology of the brain. I mean, when you think about why don't we have better screening? Why don't we have better imaging tests? Why do we have to ask the little questions on the field as opposed to sitting in with a more definitive test and having a better sense of the prognosis and when it's safe? I mean, there's a lot of research that needs to be done, and the NIH, again, with its own authority and resources, is pushing forward on that in the context, certainly, of traumatic brain injury and Alzheimer's disease, which are also stimulating more general interest in brain issues and will have a tangential but very real impact on concussion management. So I'm a big believer on the administration in terms of focusing our efforts on administration at this point. I could go on at length. Terry's asked me not to. And so but just in terms of thinking about as we move forward, where should be the targets for our policy efforts?
I think that's really helpful. I mean, one of the things that really struck me with what you said that resonated with the previous panel is making the connection between concussions and a disease. I mean, the development of the brain. I mean, a lot of our student athletes were talking about the fact they never heard of this injury before. And it seems to me that particularly with making something a salient talking point that members of Congress are going to get behind is relating this to a public health crisis and making those connections. And I know we have a lot of practitioners in the audience, and I just actually want to ask any of you who have had success in your policy efforts if you would want to share any anecdotes you've had and how you effectively have kind of framed this message that you've seen resonate effectively with policymakers in some of your work.
It convened all of the athletic trainers, the athletic directors, and started talking about these protocols on how to deal with this. A lot of that stuff you can do in your own community. You don't have to come up here to Washington to get something done here. It can trickle up from the bottom up. And I think you have a much more likelihood of And when they find out that these things called concussions and it can really hurt their kids, people start really getting, put your kids and your money in your school district. Those are the two most controversial things in politics, and people start paying attention.
Right. Thank you for sharing that. Yeah.
That's exactly what we did. University of Miami, Jillian Hotz, director of the Kids Neuroscience Center. We went to our school board and we did a shock and awe with the head of the trauma service and myself about 5 years ago. We showed the data and we said, you need a countywide program here. And so we have a countywide program, and as I said to the people from athletic training, we have athletic trainers at every school. So those people are your goalkeepers. They're your people at the front line that are helping us identify and get them into a proper system. Baseline testing, follow-up, and it's one system. And so you definitely have to start at the school board level.
USA Today. Today. Can y'all read this?
Not
It
that far.
says, lawsuit alleges unsafe tackling led paralysis. What we did, of course, this has been coming. You can pick it up every day. But what we did about 3 months ago was we went to the State Superintendent Association, got the board that runs them, and said, you're about to lose your insurance carriers.
Making the connection
Because it was written by Easterwood was his last name. On ESPN.com, the minute the NFL suit came down, he said this was never about the NFL, and every school district better get ready.
It's a really interesting point you made about the connection with insurance, because we know that's a pretty popular debate that's happening right now.
They got the message really quick.
Yeah, I wonder, to our panelists, do you see an opportunity potentially with the discussion that's happening around reform of the Affordable Care Act and insurance to use that as a bridge to our issues, to potentially connect those dots and give our topic a broader pulpit to connect with?
Well, I would think, I don't know if that is focused on liability insurance, or is that...
That would be the insurance that carries liability, but just the coverage they have to have athletic clubs.
Mm-hmm.
And the superintendents of all those school systems, they're the ones that hold the responsibility of having those insurance carriers. And every school system's got them.
Yeah.
And they're about to feel the crunch of these. This is about to be rampant.
Yeah.
Every community has got a plaintiff attorney that's looking for, this is just going to send it to another level, right? These have already been won in about 5 different states. You go back and check the history.
Yeah.
In fact, there's not one that's been lost. Defending these is not very good stuff.
So, from a public policy and what we can do perspective, yes, there is a link between the conversation that's happening around the Affordable Care Act and these situations. Many of these kids who would have lost their ability to walk or perhaps been partially paralyzed would have problems finding health insurance later in life. But now, because of the Affordable Care Act, there are some conversations about them not having pre-existing condition or not being able to not have insurance because of a pre-existing condition from an injury in football. It's a conversation we're having at the professional level because many of our former NFL players were having very difficult times finding health insurance after their NFL career would end. Many of them even had spouses whose insurance policy would have carried them, but because of pre-existing conditions, they could not be accepted under those insurance policies. Mm-hmm. That's a problem. It's a concern. What have we done about it? We, at the National Football League level, have used our ability under our collective bargaining agreement to set new concussion protocols with the National Football League. We also created a committee within the National Football League Players Association to talk to our players as well as some subject matter experts to come up with concussion protocols that we believe should happen on the sidelines and as a part of every game that's played in the National Football League, with the hope being that those protocols then trickle down to the state and local level and so that those protocols are available for other entities that may want to use, mirror, or develop their own protocols based on what we're doing at the professional level. We don't expect everyone to do what we do, have an independent neurological expert on the sidelines, having a person in the review booth upstairs reviewing every play to see if there's the potential for concussion, rushing a player in for an MRI or other diagnostic testing if they are showing signs of a concussion on the field. Everyone can't afford to do that, but what you can afford to do is make sure that you're protected, carrying the right insurance, making sure that you have the right athletic trainer or right athletic staff trained properly through our Heads Up program that we do in partnership with the CDC and other governmental entities, so that you can respond correctly and protect these players before they get to a place where they're paralyzed because of something that happened on the field.
And to your point that, you don't expect everyone to do what you do, I mean, what is fair to expect of our school systems? And in turn then to ask our federal government officials, our administrative agencies to impose or give directives to. One of the bills that is about to be introduced with Representative Bishop and Miller deals with the issue of return to play protocol. And what's interesting about their legislation is that it not only addresses the issue of concussions that are obtained during interscholastic sports, but also that there is an obligation upon the school athletic administrators to be notified, if they are notified that an athlete or student has received a concussion outside the school, whether it's doing sports or band or whatever the case may be, horsing around the backyard, that they are still held to those same levels of return to play protocol. And the school officials, the principals, similarly are on notice that they have to accommodate those kids in the classrooms. And so I wonder, what do you think is the appropriate level of federal government reach or regulation in our school systems?
I mean, I certainly agree that a lot of these decisions should be left to be made at the local level. But at the same time, I do think that there are some opportunities for the federal government to push it more. I mean, besides the data and the research and the policy impact analysis, certainly we can do that. But what we do for some of our other programs, some of our major grant programs, is that we condition state or community receipt of those funds on having certain policies in place. And so it could be an interesting question where for some of the CDC grants or other agencies, should we say that your eligibility for these funds is contingent on you having a return to play policy or whatever other set of youth sports safety policies that would be helpful. I think it could be very interesting to go through it and think about what are the possibilities. And again, that would be something that would not require necessarily require new authorities or legislation at the Congress. I mean, the other opportunities, and this conversation is stimulating ideas, and so again, it would defer to all of you here to know if they made sense or not. But on some of the discussion about the culture changes and how do we instill that, and I wondered if there would be opportunities through the conversations around the President's Fitness Test or the update of the physical activity guidelines, or if there's other activities through the President's Council of Fitness, Sports, and Nutrition that could kind of get to the broader culture issues, or for schools that are engaging in sports, which we're promoting. These are some also the additional matters that we should include as part of the guideline discussion or the updates. I mean, that would be some other possible policy opportunities that I would just throw out.
Yeah.
Although the funding, of course, the funding opportunities, I think, would have the most leverage for obvious reasons.
Absolutely. Joyce, do you have
Just
other-
listening to the brave young people who had been injured in sports in the previous panel, it really sounds to me like this is an issue where the coaches have to come in and understand the seriousness of the potential for injury and how it can impact people for the rest of their lives. And the way to enact that leverage is at that local level. And so for the person who's taken on the school board and tried to enact influence at where the rubber meets the road, I think that is where you can have the most powerful and the most direct impact. And that can trickle up to the federal level. For example, with the current Congress frequently passes legislation providing Congress a sense of Congress or the opinion of Congress or advocacy of Congress toward a certain issue. And so I would think in today's climate, especially with the House, legislation that would put a member of Congress on record as supporting measures at the local level perhaps to prevent these kinds of injuries, then you could get a sufficient number of members of Congress to sign on to a simple resolution like that. Then you could take that down and have that member of Congress on record as supporting this issue. So this is a good way to have members on record, but have them not uncomfortable about an overreaching federal government. But really, I think that the way to have the greatest impact is to engage with the school board. And I mean, I have friends from school who are coaches. And again, listening to those young people, it really sounds like the coaches have to be educated to not teach their kids to hit just for sport. And that those coaches attend coaching conferences every year. So why not try and have some kind of symposium during the coaches conference that really shows the data, like the woman from Florida who had a great impact, it sounds like, at that level, that this really impacts people's ability to concentrate, focus, and think later in life. And I think if more coaches saw that data, that they would be influenced. So I would try and impact there.
You made a really good point when you talked about kind of using the bully pulpit of Congress to be put on record in support of some of these initiatives. And we've actually seen with Senator Menendez's legislation last session that didn't go anywhere, but it actually influenced some of the work the CDC was already doing. And the legislation had requested them to do a study, so they had partnered and ended up working on a new study. We have a huge pulpit with the Let's Move campaign. I mean, are there opportunities, maybe not necessarily to advance policy given the climate, but to leverage the voice that our federal officials have to give influence to more localized action?
Yes, especially your conservative members of the House. They view education issues as a state and local issue. So if you can engage, if you can message that way to them, they sit and say, we understand that in areas of education, conservative member, this is a state and local issue. And let me tell you the recent data on concussions and head injuries and, the stories of these young people. And we ask for your help at the local level. And they may say, well, there's not a whole lot I can do in this area because I'm going to leave this up to my state representative or to our county board. But you could invite them to come to a school and talk about the issue in general, or visit somewhere in the district and at least talk about the issue.
It also seems like when you, what we've seen is that when you present them information like the information discussed by the young lady from the University of Miami, it creates a certain amount of accountability. Now you can't back away from it. You can't deny that this information's out there. You may question it, but your questions will probably end up with you finding more information and at least building on that accountability that was established by you finding out the statistics the first time. That's one way you can have members of Congress go on record, make statements about the statistics that are out there, and provide some level of support to the accountability that you need on the local level. Perhaps your school board or maybe even your principal, they're looking for someone else to say, you really should take this seriously and this is why. And if they could say, the reason I'm taking this seriously is because my member of Congress has said that this is the number of concussions that's happening in this sport around the country, and that's why you should take it seriously. We ultimately believe that the issues around sport and return to play are bigger than just concussions. It's bigger than traumatic brain injury. It's about accountability and making sure that we're accountable to not only ourselves, our families, but also the people that are in control of the situation. As was previously mentioned, coaches have a great deal of influence. And if you think the coach is going to be disappointed in you for not returning to play, then that's going to influence your actions. And if you create a sense of accountability in that coach by saying, if you make these kids return to play or if you make these players return to play, these are some of the things that could happen as a result of that. And hopefully that accountability will kick in on their level as well.
Okay. Hi, Chris Giza from UCLA and AAN. I wanted to get back to the discussion about, legislating and policy because I want to make sure, I think the idea of having coaches education and local initiatives is very good. I think the idea of legislating policy, particularly return to play policy, may be putting the cart before the horse. We just had the IOM report that came out last week that essentially said there's no really good evidence for a return to play protocol. And so we all want to do something good, but I don't want us to be misguided that by taking some action without a foundation that we may put into place legislation that's then hard to modify once we do get the proper data. And I think this comes back to what Dr. Hicks was saying earlier, is that we need the information first so we can make an educated policy that can then be implemented.
I guess I would challenge that a little bit, because in this town it takes years to get policy passed. And oftentimes, you know, from a lobbyist perspective, you put a bill out there to get the conversation going, knowing full well you're probably 4 or 5 years out before it's getting passed. And I definitely think you're right that having a rigid bill that sets specific return to play protocol is premature and is probably inappropriate at all times, because that's going to be ever evolving as new science is developing. But I think having legislation that requires states or schools to have some type of return to play protocol and some level of programming that they can decide locally that addresses this issue is appropriate and could in fact be a potential role that the government could play. But I want to turn to my friend Robert in the audience, who's actually with the New York State Athletic Association, because we've been talking a lot about, you know, what the schools need and you know, what's going on at the local level. And I know the National High School Federation has actually already done a lot in this space. And I'm just curious, from your perspective, you know, what do you see as the gaps that potentially a policy initiative at the federal level could help support or enhance the work that you guys are already doing?
Thank you, Terry. Terry and I had an opportunity to speak. I'm Robert Zayas, Executive Director of the New York State Public High School Athletic Association. We work on behalf of 800 schools in the state of New York and nearly 600,000 kids. And Terry and I actually met in April when we spoke here in D.C. Pertaining to this subject as well. But I want to make sure everybody understands that there already are systems in place throughout every single state, throughout the United States, as far as high school governing bodies. I happen to work on behalf of the New York State governing body, but I worked for the past 10 years before going to New York for the New Mexico High School Athletic Association. So there already is a system in place to impact high school sports and many times middle school sports. But we do not have any jurisdiction over those sports of club sports or AAU. We also have a national governing body that's based out of Indianapolis. It's the NFHS. And the NFHS has a wonderful online program called NFHS Learn, where every single coach right now in the state of New York, for example, is required to have some sort of concussion management training. And over 1 million coaches throughout the country have went through the NFHS Learn concussion management program. So I think that's a testament to the work that the NFHS is doing and the work that each individual state association is doing, because we've lost 2 students in the past year since I've been in New York, one cross-country athlete and just recently a football player in Western New York. And I take that very seriously. As the director of New York, we have to continue to improve our ways of educating coaches and making sure that we're teaching the proper technique. But at the high school level, I do want to make sure that everybody realizes we do have a very solid foundation of a governing body, and each state has a state association that's focused on this area. And anything that your states can do for you, I want to encourage you, go to your state associations, reach out to those executive directors, let them know you're concerned, and let them know you're willing to help, because I think that's the first step in the direction of continuing to make strides in this very challenging area. Thank you, Terry.
Other comments or questions from the audience? Yeah. No concussions on the play.
Hi, I'm Rosemary Moser, Sports Concussion Center of New Jersey. In terms of the federal and state initiatives, I'm wondering whether there can be some sort of working together, and I'm going to pose this question to all of you. I know in the state of New Jersey, for example, we have a peer review law for mental health, and obviously in the federal level we have HIPAA. However, because the peer review law in New Jersey is more protective, that supersedes HIPAA. But still you have the state and you have the federal. Likewise, as was mentioned before, with the parity in terms of insurance, federal legislation came in to address that. I'm wondering if states have laws regarding, for most states, schools. What about non-school sports, whether there might be some sort of federal intervention in terms of if a state has certain policies for school sports, then there should be parity of some sort or some sort of coverage for non-school sports, because the reality is most kids play non-school organized athletic sports.
So I'm sorry, to understand your question clearly, you're asking like what policies could be potential for the non-school sports? How do we regulate that?
And we're talking about federal versus state and
Right.
how we need to do stuff on the state level, but is there anything on the federal level that could be done to enhance or support states or, promotion of protection of kids? And I'm wondering, can in some federal way our legislators come to protect those kids who are not covered by these state laws?
Yeah, I mean, that's a really good question, and it's a tough one because the short answer is not really. I mean, there isn't a clear jurisdictional hook. You have the Amateur Sports Act, which governs kind of open amateur sports, which regulates all the national governing bodies and the youth sports that fall under their jurisdiction. So USA Soccer, for example, would be accountable to that and all the youth programs within that. But that doesn't necessarily deal with athlete safety. It really deals with kind of the development of open amateur sports and the creation of Olympic teams and junior development programs. But that would be the only vehicle that I'm aware of. I don't know if our other panelists have other ideas of what a hook could be, but reopening the Amateur Sports Act is something that's just not a very viable option and currently doesn't have a mechanism to address that. But I think your point is well taken, is that we are missing a significant population group by not addressing the out-of-school time sports. Do you have other ideas of how we could get at that population group?
Actually, in fact, if we look at the state laws, what we see around the country in the 49 states and D.C. is that they are only partial in terms of their oversight of youth sports. So, for example, in Maryland and in D.C., they actually include the non-scholastic, non-high school level youth sports, so going all the way down, and those sports that use public facilities, whether it's a elementary school gym, whether it's a public park, right. It's a recreational field, whatever. So there actually are some teeth, and actually the teeth to that is that you have to have a use agreement right. to use that, and the state law is such that use agreement, in other words, the contract saying that my league is going to use your basketball court or your soccer field or whatever, requires you to have insurance and to follow certain rules and guidelines. And in those guidelines are that you will follow the state law requiring your coaches to be educated on concussion. The when in doubt, sit them out rule applies, all those kinds of things. So one thing I would strongly encourage is that we re-examine our 49 states and D.C., although I know D.C. already does it, to make sure it includes the non-high school level. Because the NFHS is a great tool for the high school level, but then it's hurting cats at the youth level, right? We have to then get to the national governing bodies of those sports to then make sure that they are bringing that information down into their sports, and they're prepared then to follow those youth laws.
That's a very excellent point to the kind of the hook with the public accommodation statute at the state level. Thank you for sharing that with us.
If I can just mention one more thing, I think it even goes deeper than just the NFHS or the governing bodies, and the word has come up several times today, and that's specialization. In high school sports, we limit the number of games that athletes are able to play in a given season. For example, in New York, you can only play 18 basketball games in a season plus your postseason. In New Mexico, it's 26 games. In Kentucky, it's 35 games. But we limit the number of contests. In club sports, they do not. And, you can play on 3 and 4 teams at a time. You can play 100 games in a season. And I don't know if we're ever going to legislate what a parent decides to do with their child. My 6-year-old daughter just got to the point where she could swim the full length of a swimming pool, and I'm already talking to my wife about let's get her in club swimming. So, I think it's one of those things that we're talking about a changing culture here and specialization, and what does that mean to our up-and-coming athletes, and what danger does that pose for them playing on multiple teams and playing an unlimited number of games, and what type of training do our coaches have at the club level or the youth level that's hopefully going to positively impact those athletes as they come up and start playing our middle school and our high school when we do have regulations and rules and that are able to impact them.
Just a quick one. It's Tony Green with Safe Kids. Terry, I think it was you that said something about Senator Udall's bill, and there's been some discussion about equipment. Could you talk a little bit more about that? I think you said there's some issues with it.
I could, but I would prefer to defer to my buddy over here, Tom Cove, with the Sporting Good Manufacturers Association, if he doesn't mind me calling him out, because I know they've been actively engaged on that bill a little bit. Or, Tom, I can defer it back up here to Joe. Okay.
I'd prefer to talk about virtually anything else but that. I am happy to discuss. So Senator Udall is a passionate advocate for increased sports safety and has a particular idea that both standards on sports equipment and advertising on sports equipment has to be more regulated. And his bill, speaking to somebody who was here before, really is driven by let's do something now. Faced with sort of the science of here about concussions not having clarity on it, that's an impasse. He wants to determine new standards, determine new ways of advertising, determine new equipment, determine new answers to the question of concussion in particular. And so his policy prescription is very prescriptive and highly regulatory. So without getting into that, I'm happy to chat with you, but that's part of the tension, which is wanting to do something definitively very quickly before the science, before the equipment, before the social structure around it is sort of there to support it.
Thanks, Tom. Joe, did you want to add anything to that?
No, I think Tom covered it.
Okay. All right.
And I guess this is really not a question, but it's a follow-up on Tom's comment. Mike Oliver, I'm with the National Operating Committee on Standards for Athletic Equipment. We establish the standards for helmets, including football helmets. And Tom and I are on the opposite sides of a lot of issues, but on this one we certainly are on the same side. Our organization is a nonprofit group comprised of representatives from many organizations who are here today. Do everything we can within our power to develop standards to protect against all injuries, not just skull fractures and bleeding and so forth, but certainly concussions where possible. And we've been trying to drive that science to get to that standard. But there is a point in time where simply demanding that you have a standard to do something isn't enough. You can't make that change. You can't incorporate that injury threshold until you have a consensus agreement among the scientists that threshold works and it will be protective, because one of the things we're concerned about is having a new standard for helmets that is concussion-based or informed by concussion literature, because parents and players will rely on that to, in fact, protect against concussions. And they have a right to rely on it if it carries our seal and it's part of our standard. And so in order to make sure that's the case and that is the truth, we have to proceed with some caution. And so we're working very hard to do that. We're getting closer, although incrementally, I'm afraid, but even large rivers change course incrementally over time. We just don't want it to take quite that long.
I'm wondering, are there other policy initiatives on separate issues that we could learn from that are similar to what we're going through? I was just watching CNN this morning, and they were talking about the new FDA recommendations on banning trans fats, and that's recently come out as science has evolved, and we're learning more about health concerns. And I think similarly, concussion is a place where we're still uncovering new literature. I mean, from your experience working in legislation and policy, are there other issues that you've dealt with or have seen that we might take some lessons from to inform how we move forward with our course in the policy arena here?
Well, because education is viewed by many in Congress as a state and local issue, it would be somewhat difficult. So if I were trying to strategize it, I would try and look at other education-related initiatives that have gotten federal traction.
Okay.
I think there's some analogy with what's happened in terms of food.
Yeah.
Clearly, because several localities and states had initiatives relative to food availability to children especially.
Right.
But it was not until 2010 that the Health and Hunger-Free Kids Act was passed in 2010, which said that all over the country, USDA had to provide healthy foods for free school lunch and meals. That had already been the case in some states, but it was not until 2010. And there's also similarities I mentioned this morning about tobacco. So we learned from local and state policies. If we keep doing the research and keep showing the broad implications of the problem, that's when the indication for federal legislation is often in place. So, which is, again, why I said it's critical that we continue the research, because as you, not only does that keep it in the public eye, but also you get new information that you can use to justify new policies.
And just following up with your point, and to the question earlier, I think, are we putting the cart before the horse? But from your experience and seeing what has evolved with food, there was legislation that wasn't maybe as prescriptive along the way, but there has been some level of regulation and legislation, as research is evolving. From your experience, is that something we could take with us for how we could legislate in this arena?
Yeah, because it was, 2004 that Congress passed the Wellness Act. And it was really interesting because the wellness policy said that if the schools are going to continue to get money for free meals, they had to have in place within 2 years policies that said that they had physical education K through 12 and they had health, nutritious foods. Within 2 years, 95% of the school districts in this country had those policies in place. But guess what? They weren't implementing them. And when they asked why, they said, because we don't have the money. We have the policy, we'd like to do it, but we don't have the money. So I think it's amazing how things evolve. And you look 2004 and then 2010, and we're not finished yet because we're still not adequately funding those programs.
Thank you.
Just brief comment. I don't think it's been made at this meeting. Jim Whitehead, American College of Sports Medicine again. That if we go back a few years, and if we had said before any state law, before this being on the public health agenda, sports health agenda, and so forth, and if we said, wouldn't it be great if one day we'd be where we are right now, with this very impressive kind of passage of this state legislation that is almost unprecedented, and while there are few exceptions, it essentially had a common model of what was looked at. We worked very closely with NFL and other organizations on that to ensure that. But we have made a remarkable phase of progress in this that we need to celebrate a little bit. But where we are is moving, I think, from a phase 1 into a phase 2. And the question for all of these issues, the media policy and everything, and the organizational collaborative initiatives and multi-sector, is what is our reset for this phase 2 that builds on phase 1 and that really gains momentum from that, but ultimately is different from what we did originally, because there was this early meeting before there were any state laws and so forth that participated in. And I guarantee you we would have accepted this as a victory because we laid out a whole lot of other things. But I think we're now ready for this phase 2 that builds on the great success that we had. But we need to appreciate how far we've come on this issue.
Thanks, Jim.
I think it's interesting in terms of moving to phase 2, and also your question about the announcement about banning trans fats. One of when I was in the department when those discussions started, I would have to say that a huge part of the success of FDA making this ruling was that there is a passionate champion internally at HHS, and that's the current CDC director, Tom Frieden, who continuously and painfully pushed the issue at every opportunity he had to the FDA, and they obviously worked very closely together to make this happen. And the passionate leader was combined with an obvious regulatory solution. The science was clear. We knew exactly what had to be done. And frankly, in terms of the industry response, it was a lot of that had happened voluntarily, so it's just getting past the final hurdle, that last 5 to 10% of products that did get trans fats out. And so in this analogy, in terms of moving forward in concussion management, I'm not sure that we have those building blocks to get us to the second phase or to catapult us forward in terms of having a very nationally recognized and passionate leader, knowing exactly what the science is telling us what must be done, knowing that we're almost, we're well along the way and we just need to get over the final hurdle. And so I think that's some of the challenges that will have to be overcome on the policy front. But thankfully, at the end of the day, there's plenty of examples, and none of those challenges are insurmountable.
Well, on that note, I'm going to wrap up. I don't want to be held responsible for keeping anyone late on a Friday afternoon. But, I think that, as Jim very nicely said, we are, moving forward, I think, into a second phase, and our policy will need to evolve with it. But I do think also, as Dr. Satcher said, that we've seen historically that there is a role for policy to play along the way, and we don't have to wait until everything is finalized, and probably in this field it's never going to be final. And so I think for our collective group to figure out, what is the policies that we can, agree upon and move together as we're gathering the research and information would be a good next step in strategy for this group. So please join me in thanking our panelists and your attention this afternoon.
And so now at this time, it's our opportunity to hear from the rest of you. I know we've had quite an opportunity to have comments and questions and thoughts and ideas, but we'd like to spend 10 or 15 minutes now just hearing any sort of things that haven't been talked about, haven't been addressed. We did our best when we thought about putting these groups together, talking about brain development and the role of the media and getting the player's perspective and public policy implications. Someone out in the hallway grabbed me and said, "Have you ever thought about where are the referees here? There are no referees here." And it was a great idea.
We have a former referee.
There's a former referee right there, so we do have one here. But what we would like to hear now for the next few minutes are any sort of things that we might have overlooked or just different ideas. As you know, this is a small room. You're in here for a reason. This was an invite-only conference. It wasn't open to everyone, so we know that all of you are here. You're important in your own right, but we all work in silos, and the goal here was to try to put this diverse group together and really start to get this cross-fertilization thing happening and going. So at this time, we have 2 microphones walking around the room, and I don't necessarily know that we're going to direct questions to anyone, but thoughts, ideas, new. So yeah, well, I'll just start walking around, and Sharon can do the same.
Dr. Satcher, I would recommend to this organization, I've been in this business, like I said, 40 years, on the playing field with it, with Dr. Andrews and all that. The cross-specialization I have here is totally unique. We do live in silos. We all have a different perspective. We're in Washington, D.C. We're where the right things are supposed to come from, right? And it can emanate from here. I would recommend, just as was said previously, that we focus on the school district. And we try to make our changes with the decision makers in the school districts, which those are superintendents. I've had meetings, focus meetings with them. I told them why they ought to be scared, and they are scared, okay? Basically because of the insurance issue and the liability issue. What they need is best practices. They need for somebody of this crossover group just to tell them you can defend yourself in court if you do this, just like you would a malpractice suit. And I think they would all gobble it up, and I think, like was said earlier, if you could get this just signed off on the Hill, no money, just let them all independently figure out how they can do it. But it can't come from the High School Athletic Association. I've been there over and over again. It's got to come from the people that are issuing authorities and accountabilities and holding accountabilities. This lawsuit here, they're suing the coach. But they're going to get the superintendent, the people that are on the Board of Trustees. I spoke to the Kentucky legislature 3 years ago when the coach got sued in the wrongful death of a player, if y'all remember that. Well, I spoke to them. What they wanted to know was, is there a standard that this coach wasn't held to? In my mind, there was, because I come from a place where there were higher standards. But there was no standard, basically, which, there ought to be standards. The standards have to come from people that think at this level. It's not going to come. Dr. Andrews is a guy that I work with, and standard of care, standard of care, standard of care. Even preceding research.
I'm going to be the bad guy and say we have a lot of folks and we want to hear from a bunch of people. We get your point. Thank you very, very much for being here, but I want to move on. So try to keep your things just a little more limited. We're going to try to get to as many people as we can.
I'm a New Yorker. I'll talk fast. Arlene Greenspan from CDC. One of the things I've heard throughout today, there's a tension between what we know and what we do. And we need to continue to move ahead, as Mona has said, on what the basic science is. There's a lot we don't know. But there's also some that we do know, and we need to use those best practices and put them into good policy and programmatic practices. And along with that, we need to evaluate what's out there. And I haven't heard a whole lot today about evaluation. And one of the things that we're doing at CDC now is we are funding a national evaluation of the 49 state return to play laws. Very small budget. We need more money to know what are the best implementation policies, what are the outcomes from these policies. So there needs to be, again, the tension between moving ahead with basic research, but also moving ahead with the public health aspects and the applied evaluation as things are put into play. Otherwise, we are putting the cart before the horse, and we're not evaluating the cart or the horse.
Let me stand up and speak for the referees. I'm a pediatric dentist from Findlay, Ohio, the Academy of Sports Dentistry, and working on some research with quality mouth guards, properly fitted mouth guards, and concussions. But as far as referees are concerned, I officiated college football for 28 years, and I'm now a working scout for the NFL for officials, so I'm seeing games every Saturday. The helmet rule that they put in a couple years ago, player having to leave when a helmet comes off, we're not seeing helmets come off now. Second thing in targeting really has changed the coach's approach to tackling. And we're really seeing a lot better tackling techniques, coach, over there than we did many years ago. But on the side of the officials, I always preached as a referee, take in consideration player safety. And when you hear people out there criticizing an instant replay because it wasn't targeting, we have one split second to look at it to make that call. And we're erring on the side, the officials are erring on the side of player safety. So defend the officials.
Christy Arbogast, Children's Hospital of Philadelphia. We heard a lot of interesting ideas and initiatives at the high school and collegiate level in our discussion today. But I want to make sure that this group remembers that we're also talking about 5-year-olds. And we know they're different biologically, they're different biomechanically. And so the solutions, whether that's assessment, prevention, even diagnosis and management, may be very different. We can't necessarily take what is working at the collegiate or professional level and just shrink it down to our elementary kids. Those solutions need to be studied uniquely because they may be very, very different. And so I just want to make a plea for the 5-year-olds too.
I'd also like to add, there's going to be a lot of comments in here. Unfortunately, we're probably not going to get to all of them. Please write down your comments. We're going to be sending out an evaluation next week that will ask for additional comments. But if there's something on your mind right now, please write it down and make sure that it stays here in the room so that we can collect it.
Hi, Kevin Walter, Medical College of Wisconsin, and also American Academy of Pediatrics. Mine will be really short because Christy just stole half of what I was going to say. But again, I echo, I think a charge of this panel needs to be not only investigating what's going on with the younger kids, but how do we implement policy to control what's going on with the other kids or improve what's going on with younger kids. It drifted towards NCAA this morning because that's a captive group that it's easier to make changes than it is youth sports where there's multiple different football leagues. You know, think of them like fast food restaurants. There's really big ones like your McDonald's and Burger King of youth football, but there's also rec leagues and mom and pop type restaurants too.
Amanda Cook, Children's Healthcare of Atlanta. One thing we ran into actually after passing our law is lack of physician education. and we haven't really addressed that, but we actually had to kind of go through a primary care education campaign. And so I know I'm hearing all the specialists here, but kind of the point of entry needs to be addressed as well. So I just say that's a good thing to keep in mind is our physicians, how they diagnose concussion is very different.
This is Jim McDonald. I'm a physician from Columbus, Ohio. Earlier there was, or just a moment ago, there was the plea for the youth. I think football's the beast in the living room. I just want to make a shout out to the women. It seems that there are some data that women are disproportionately affected by this injury. They respond differently. They recover differently. So as we think about different populations, I think focusing on women as well as men and how they might respond differently, how they may need to be treated differently and evaluated differently is very important.
Involved in a lot of collaboratives, and this has had a distinctive element to it that I think is exciting, and honored to be with all of you today and afterward. Just real quick things, what I would recommend. I think, number one, we need a model. This is no longer an emerging issue. We need to really function in that light and move it to a second phase, is indicated in there, things for that. Need a model. Brings all this together. Secondly, connect dots. The good news is there's so much going on now on this issue. The bad news is there's so much going on with this issue. I mean, it's like, how do you bring it together? We've got to really focus on connecting dots. Second, focus on needle movers. Needle movers. What are the true things that are going to make a difference, and really concentrate significant resources and effort to those. Next, just two more. Human face on this. We were touched by, weren't we, by the stories of the students and their parents and guardians and so forth. We're not seeing enough of that consistently, and the power that brings to the issue. And then just lastly, we need to look at this in a bipartisan way as most we can. If you talk to most members of Congress just about the issue, not what the solution would be or how much it would cost, they will get into this, and then you start looking at how do you have this. And last point, I think Joe made this point, we need to not think of this as just a health issue. We're talking about what are the other co-benefits or the other aspects of this. This is an economic issue. It's a social justice issue. It's an academic achievement issue. It's a productivity issue for the country, for organizations, for individuals, and so forth. So I look forward to working with all of you as we begin to build these elements into this phase 2 of success.
Hi, Jerry Joya from Children's National Medical Center. Just want to re-highlight again the concept of prevention, because that ultimately is really where we want to go here, be it primary prevention, where we're going to stop this from happening, or secondary prevention, where we're going to certainly catch it right away and manage it. The primary prevention certainly includes the public health sector, and I think really the good work that's been happening with the CDC and Heads Up, as well as other organizations that have been working hard, we can actually bring that to our communities in a much, much, much more effective way. I just want to highlight that it is more than just awareness. It's really action steps that we can take. But the second piece then is really with our medical communities. And we've talked about this and really needing, whether it's in Atlanta, teaching our primary care folks, but we've got to look at how we activate our medical communities. And in the sports medicine world, and particularly when we think about prevention, we're very early in this process. But really marrying the sports medicine world with our sports and examining how we teach the sport, how we break it down to ultimately, with evidence, come up with the best ways to teach that to prevent the injury from happening. So prevention.
Is on? Yeah, this is Lee Hansen, Guardian. Everything we've heard here today is fantastic. We're talking about research. We're talking about education, technique, policy, treatment. One of the things that we do need to concentrate more on is preventative on the equipment. I think there's better equipment that is out there. There's things that have been proven. Mark Kelso was just telling you a few minutes ago, 20 years ago, he had a piece of equipment that was working for him. It's worked for Steve Wallace. It worked for several other NFL athletes. It got kicked out by large corporations. Large corporations ran it out of the business. 20 years later, that similar technology is still available. It's getting run out by large corporations. And Mark maybe can give you a better understanding quickly of what happened and where it is today. So, Mark, could you say a couple of things?
Well, when I hear that we need to travel slowly, I get very frustrated because I've been doing this road since 1989. I do think there's opportunities to protect our young people, and what I said before I think is what holds true. We need to get into a room and everybody needs to collaborate. The sad part about the whole thing, particularly even with League of Denial and all those things, I was asked to comment on that movie, and the only thing I could say about it is this. Because those guys were iconic for me. The only thing I could say is that when there's a lot of money involved, there are a lot of conflicts of interest. And unfortunately, we're putting conflicts of interest in front of the safety of our kids. And that needs to stop right now with this conference. We need to find a way to solve the problem. There are ways to solve the problem. We just need to do it. Because I've been trying to champion this cause for 20 years. The time is now. We need to make it happen now, or else we're not going to allow those kids, those beautiful young kids, to experience the things that they could have experienced if they wouldn't have had to leave the game because of an injury.
Hello, Latrice Sales with the NCAA Sports Science Institute. And one of the gaps that I think that we should think about is every sport kind of taking that approach from your sport in the same way that USA Tennis was able to do and USA Hockey. And how can you, within the realms of your sport, within your playing rules, how can you change the game, or how can you make it developmentally appropriate for those young athletes? What can you do from that sport level with governing bodies, or through a national governing body, or through Pop Warner, or through those levels to decide for our sport, for soccer, for gymnastics, for cheerleading, for swimming and diving, how can we address this issue from our sport level? What can we do differently at practice? What can we do differently with the way we plan games and matches? What can we do from this sport level? Because we try to think of things that are universal. But what you do in baseball, you're not going to do in tennis. You're not going to do in soccer. So how can we address it from that sport level? And that gets coaches involved. That gets the strength and conditioning coaches involved. That gets parents involved, because it's more focusing on what's going on that field and what we can do for this particular sport to advance it throughout their career, their athletic career.
Mona Hicks, NIH. So I think a needle mover would be to understand how the concussion actually affects the brain. And to that end, we're planning to launch a donor network. And this is something that this group could definitely help, because the good news is young people don't die very often, which means we would need many, 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 many people to volunteer to donate their brain should some sort of unexpected early death take place. And at that time, then we'll start to really understand what is going on. So this is something we're going to launch, and this would be a great group to help us.
I'm going to try one more time to convince you that the heart is smarter than the brain. But it is true, and no one's actually mentioned this, I don't believe, but the brain has a memory. And if you're starting to get your first concussions when you're 5, 6, 7, 8 years of age, and you learned how to get concussions and hide concussions and so on from tackling techniques or hitting the soccer ball or whatever, that's a cumulative process. And then you look at what happens in Denver, at least. 8-year-olds playing football, they're cheerleaders, they're parents who are very vocal, they have pep rallies, and sadly, in some instances, police have to be on the sideline to keep the parents from fighting each other. Now, in that setting, do you really, really believe that if we as a community say you've got to take that child out because he may have had a concussion and is the only talented quarterback on that team, given that background of what's going on with the parents, etc., that's not going to work. So I think we have to call on the officials and other regulations to say if a coach violates that, he's out of coaching. Because otherwise, he's not going to bow to what we want under that kind of pressure. I think that's just the reality of which we're living in.
Tom Cove, Sports and Fitness Industry Association. Just quickly, I would just highlight the importance of the physical inactivity epidemic in this country and the linkage to youth sports safety, and that we could, going forward, focus on the quality sports and active lifestyle experience and understand the connection all the way through, particularly highlight the importance of physical education quality physical education that ideally would protect against sports injury simply by having good physical education.
Hi, Julie Wolfrada with the Foundation for NIH, and there's been a lot of conversation about the need for more research to understand all of the underlying things better, and just a quick plug for that because it's very expensive, and what we're trying to do at the Foundation is broaden the consortium of people and groups that are trying to fund that. So if anybody resonates with that, let me know, and I'd be glad to hook you up.
Hi, Rosemary Moser again. I don't know if we spent enough time on this, but I'd like to also address the unequal distribution of services and resources. For many in disadvantaged communities, football is often the perceived ticket way out, yet it is those communities that have the poorest, worst concussion programs. And I think we need to address that. I really do.
David Tischer with the orthopedic surgeons, and just for my colleagues about the heart pumps blood to the bone, and the brain makes the muscles move the joints, so we know what's most important. You talk about needle movers. I would encourage you to think about looking at studying the direct and indirect costs of these injuries and the treatment, the disability costs, the time away mom taking the child away from her office, not able to work, having to be with that young fellow that was home for 3 months, all those costs. We've just done some massive studies that are coming out. Total Knee just was published because total knees are expensive. It takes $20,000 to do a total knee, but the costs that are saved by society and that individual are over $40,000. It's a 2-for-1 return. That's how you can get policymakers to understand what they're going to do to intervene may save society an awful lot of money in the end. So I would encourage us to think about that as an area of research, looking at the direct and indirect economic costs of these injuries, because it may be that we cannot develop a helmet that two people can run full force at each other and hit each other and still have that safe. Or it may be it's going to be a very expensive helmet. But we're going to have some evidence-based medicine behind what we're recommending, otherwise these policy decisions won't work. So there are 3 other things that need to also be talked about beyond the equipment. The predictability. Can we stratify risk? Can we predict which one of these athletes before they get hurt is likely to get hurt? We don't have any evidence on that. Can we have early detection of that baseline or that minimal injury? And can we also know with predictability of where that other injury is going to happen and the catastrophic injury? And then lastly, we need to have interventions that actually work. We need to prove that they work, and we need some testing that proves that we know when it's all right to go back. We don't have that.
Judy Polici with the National Athletic Trainers Association again. You know, earlier speakers have talked about taking it local and about giving the good news. The NATA launched a Safe Sports School Award back in March, and it's our goal to give one of these to all 18,000 high schools. It doesn't cover youth sports yet. It doesn't cover some other things that need to be paid attention to. But if we do have sort of a set of best practices, or at least good practices, and so any school that can meet that criteria, we'll give them an award, and they can take bragging rights in their community.
This will be the last comment before our co-chairs give their closing reflections.
Well, I'm delighted to be able to have the last word. Valerie Mahomes from the Child Health Institute at NIH. I want to second the motion made by my colleague about children in underprivileged communities and under-resourced schools, and needing to connect this with our research on health disparities, looking at the long-term implications of this. These children have pre-existing vulnerabilities that may be exacerbated by sports concussions, and we need to really look at what might be some of the underlying factors in these health disparities. And I think bringing these 2 lines of inquiry together might help us get at that.
And now, Dr. Sorrell, would you like to take the podium and share with us your closing reflections?
Gladly. Thank you very much to all of you for an extraordinary day.
I think we have a model. This is the model. It is transdisciplinary, it is systemic, it is systematic, and it is integrative. We do have the model. Now, we do not have sufficient evidence, scientific evidence. So you have a paradox here. We have a model, but we don't have the best scientific evidence we'd like to have. Having said that, that doesn't excuse us from not taking action. I think we need to take action on the best available evidence while we enhance our evidence. So the challenge is both taking stock of what we know and do the best we can with what we know, while stimulating what we do not know and finding what we need to know to enhance those policies and procedures we want to do. Now, there's a very interesting, I believe, a feedback loop between evidence and policy. Don't have to convince you of that. Evidence is essential to inform policy and to influence policy. And I think to be able to do that, I think a stratification that communicates with each other in a systemic, integrative way is to have a platform of evidence that is scientific. At the top of that, and there's a middle level I'm going to get to, is the narrative of the experiences of the players and the parents. You heard some of that today. That was heart-wrenching and very revealing. In the middle is the best practices, accountability of coaches, of players, of parents. These three levels need to interact with each other the way we've interacted here today. So in terms of looking forward for the work ahead of the Council, you really have helped us immensely today by setting almost our course for what we want to do with the Council. What we want to do is precisely what you've told us to do. Develop a model. I think we know what that model is. It's right here. It has to be transdisciplinary and integrative and systemic. That policy needs to be a high priority that is informed by the best available evidence while pursuing getting the better evidence. And not to forget the issue that success, safety, and enjoyment in American sports are not mutually exclusive, and bring to bear and make it a reality. Last but not least, we need to bring the story, that narrative, to the larger public. It cannot be just in these wonderful events like we have today. It has to be reaching the entire American population. I think Lamar made a very good suggestion today about Tony Dorsett being the image of that. I think the two young people, Ian and Allison, were wonderful. I think if you think about these two, I'll call them icons, if you will. Forgive me for the hyperbole. Tony Dorsett and these two young people. We need to develop these messages to reach the entire public. The way we did it with the smoking, with the National Advertising Council for the whole country, a campaign that went on for weeks and months. We need to do for this with those who are the images of it. Thank you very much for coming. Thank you for your contributions. We are inspired by your ideas, and I assure you that Dr. Satcher and I will carry forth the council with your help, and those of you who will be part of it. God bless you. Thank you.
And now, as Dr. Satcher makes his way to the stage, I want to take one more opportunity to thank, once again, our student interns who helped us, Jonathan, Cassidy. They've been blogging and tweeting and all that other good stuff. Terry Winston, who helped us with all of our PR. Terry. Sharon Rachel over there, who basically ran a bunch of stuff. And both Duraka and Ashlyn, who I'm telling you, I've had the opportunity to work with Ashlyn over the last 6 or so months, and every moment of every waking day, I mean, she has just dedicated herself to the successful conference that we all had here today. And so she will, you haven't heard the last from her, but she is going to be the point of contact. And she did a phenomenal job, but it was also with the help of Duraka Satcher. So thank you we already acknowledged her. See, if you weren't out of the room doing something, you would have heard that we acknowledged her. But you were more busy. So now, thank you once again, and Dr. Satcher.
Well, thank you very much, Chris. for doing such a great job yourself. Let's give him a hand. I want to first say amen to what my colleague Elliot Sorrell said, and then I don't have to repeat it because it was so well said. So I'll just say amen. Amen. There's no point of, I know you're all ready to go home. I will specifically thank the people who chaired the panels. Elliot chaired the brain panel, the media panel, Lamar Campbell, outstanding job also. Mark chaired the panel with the students, and so revealing to hear from them. It was amazing. And Terry, the panel on policy. So all of the chairs of the panels, but also the participants in the panel, we want to offer a special word of thanks to you. Ms. Gibbons. Since I don't have to worry about discussing details that's already been done, I'll end with a story because I enjoy telling stories. You probably picked that up. Public health is an amazing field that has been inadequately recognized and supported in this country, and I think we're beginning to move in the right direction. The Affordable Care Act certainly attempts to move us more in that direction. CDC came up with something years ago. I won't say who was the director then, but the public health approach, and I just want to make sure that we're together on it since you've done such a great job here today in illustrating the public health approach. There are basically 4 steps in the public health approach, right? The first question is, what is the problem? And in order to answer that question, we have to have the very best surveillance, because implied in that question of what is the problem, it is how big is the problem, what is the nature of the problem, and how is it distributed among different groups. Those are questions that we try to answer in that what is the problem. And it requires research. CDC has been sort of the leader in supporting that kind of research as to describing problems and how they are distributed. And CDC has a major role to play here. The Institute of Medicine said that in their report, and I want to repeat that. We need better surveillance when it comes to this problem of head injuries and their implications. The second question in the public health approach is a difficult one. It is, what is the cause of the problem? What is the cause? Sometimes we have to describe associations long before we get to the point of answering the question of cause. We can say, well, concussions are associated with, head-to-head contact, or we can describe other association. We don't necessarily fully know the cause when we know the association, so the research has to continue, just as it did with tobacco. The third question is, what works? What actually works to reduce or prevent the problem? And I hope you're thinking about head injuries and concussions. What is the problem? What is the cause or the risk factors for the problem? And then how can we intervene? I think we spent a lot of great time today discussing the problem, but also acknowledging that we need more information. Diagnosis, for example, we've heard from experts that we still have problems with diagnosis of the problem of concussions, the students and others. So we have to keep looking at that while building on what we already know. But the question of how do we intervene to prevent or ameliorate the problem is one that I think brought us together here. Because if you tell me that 49 states and the District of Columbia have already developed policies, and yet nobody is satisfied with the policies, and we shouldn't be. We've got to find a way to protect our children. And we have to admit that when we talk about return to play, which is very important, it is after the fact, right? It is when do you return to play? And it's going to be very hard to answer that question because not everybody is the same. And not all students are going to respond the same to head injuries or concussions. So there is a lot more research to do. And one of the things I hope this group will do before I get to the sort of immediate thing is that we have to really advocate for research in this area. We have to be very clear that we want to be able to answer those questions. We want to have a basis on which to build policies. And it's not just only policy. I hope we've made that point too. You can have policies in place and still not have practices that are consistent with those problems, those policies. I mean, everybody will sort of agree that our children need to be more physically active, that we love to see our schools return to physical education K through 12 and to model good nutrition. But then when the schools try to do it and they point out we don't have the money, how many people vote for more money to support those things? So there's this big gap between policies and practice that we have to try to bridge. Let me turn to tobacco as I close. And Chris always asked me to tell this story, which I sort of love to tell. But you saw the picture of Luther Terry holding the first ever Surgeon General's report on smoking and health. Well, the story is, this is the rest of the story, those of you who remember the rest of the story. Luther Terry, on the way to the press conference to release this report, was nervous. I understand that. I released 14 reports as Surgeon General. It's a big thing. Sometimes the president was with me, and I have a picture in my office of walking with President Clinton to release my first report, and it was on minorities and smoking. But on the way to the press conference, Luther Terry was nervous, so he was smoking more than usual. So his assistant said, well, Dr. Terry, do you know the first question they're going to ask you when you release this report? And Dr. Terry said, no, what's that? I had a great assistant. Is Damon Thompson still here? He may. Okay, Damon is outside, but he was my public affairs person. But so, yeah, Dr. Terry said, no, what's that? And the assistant said, well, Dr. Terry, they're going to ask you if you smoke. And Dr. Terry said, oh, they wouldn't ask me that. I mean, why would that? That's not as personal. Why would they ask me that? So Dr. Terry went on to the press conference and just did an outstanding job. First question, Dr. Terry, do you smoke? And Dr. Terry said, no, I don't. Well, the reporter had done his homework. So he said, well, Dr. Terry, when did you quit? And Dr. Terry said, I quit 15 minutes ago. And he never smoked again. He never. In fact, his son, Michael, was telling me the story when I was with him once when I had released a report on reducing tobacco use. He said his dad, for the rest of his life, walked around with a lapel pin that said, thank you for not smoking. So good research is important, and sometimes it even changes the one who releases the research, in this case. So we ought to insist on quality research, but we also ought to insist on educating the American people. And I have to tell you, the way we responded to those students, how many people in America really appreciate the nature of this problem? So what are we going to do? A lot of people complained when we started showing pictures of lungs of people who had smoked for years. Awesome pictures, but it's led us to dramatic reductions in smoking. So is that day going to come when we're going to have to really show some gross pictures to people for them to get to appreciate how significant, how serious this problem is? And those gross pictures can be students telling about how hard it is to remember or to take a test. Do people in America really appreciate this? So it is possible to enjoy sports and at the same time to be safe. But we're going to have to go through some difficult times in order to get there. So I know we can get there together. It was the Secretary of Health and Human Services, John Gardner, who said, life is filled with golden opportunities, carefully disguised as irresolvable problems. And I think we have one. Thank you.